Welcome to a new episode of Medicine in 3 minutes. As usual, we go to straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is glossopharyngeal nerve. We start with the definition, embryonic origin, localization, nuclei, trigeminal spinal nucleus, inferior salivatory nucleus, Nucleus solitarius, Nucleus ambiguus, and then we have for the afferent fiber GSA, GVA, and SVA, and then efferent fiber GVE and SVE. The glossopharyngeal nerve, the ninth cranial nerve, is a mixed nerve that carries afferent sensory and efferent motor information. It exits from the brainstem out from the side of the upper medulla, just anterior, closer to the nest, to the vagus nerve. In pontine, just above junction of medulla. There are 4 nuclei: inferior salivatory nucleus, Nucleus ambiguus, inferior salivary nucleus, Nucleus ambiguus, solitary nucleus, and trigeminal nucleus. 9, 10, 11 are attached to the medulla at the posterior lateral aspect of olive, in vertical line of posterior olivary sulcus. Here's the foramen magnum, and here's the glossopharyngeal nerve 9, and then vagus nerve 10, and then cranial part of accessory nerve 11. On the cranial view, glossopharyngeal nerve 9, vagus nerve 9, 10, and accessory nerve 9, 11. From the embryonic aspect, the motor division of the glossopharyngeal nerve is derived from the basal plate of the embryonic. Here's the basal plate, the alar plate, and here the basal plate, and the motor division. On the other hand, sensory division originates from the cranial neural crest. Nuclei of the glossopharyngeal nerve: Nucleus of Tractus solitarius, inferior salivatory nucleus, spinal nucleus of trigeminal, and Nucleus ambiguus. There are 3 afferents and 2 efferents. Afferents first, GCA, coming to the spinal tractus trigeminal, SVA, coming to the nucleus of Tractus solitarius, and the efferents are coming from the inferior salivatory nucleus to the parotid gland, and from the nucleus ambiguus to the stylopharyngeus muscle. 4 nuclei, 2 efferents from the inferior salivatory nucleus to the parotid gland, and from the nucleus ambiguus to the stylopharyngeus muscle. 3 efferents. The first one, GSA to the trigeminal spinal nucleus, GVA and SVA to the nucleus solitarius. Trigeminal spinal nucleus, GSA, general somatic afferent to tympanic branchial and external air, meningeal branch. Touch, pain, and temperature. Trigeminal spinal nucleus, GSA, afferent to tympanic branch and external air and meningeal branch for touch, pain, and temperature. Nucleus solitarius, lowermost part of the nucleus solitarius. GVA, general visceral afferent, touch, pain, and temperature, posterior third of the tongue, soft palate, tonsillar, pharynx, eustachian tube, carotid body, baroreceptor, and chemoreceptor, and nucleus solitarius GVA, general visceral afferent, carry visceral sensory information from the carotid sinus and carotid body. Nucleus solitarius, upper part, special visceral afferent, SVA, carry test from the third posterior part of the tongue. Inferior salivatory nucleus, GVA, motor fiber parasympathetic outflow, go to the middle ear as tympanic branch, lesser pterygoidal nerve, and otic ganglion to end into the parotid gland. Nucleus ambiguus, SVA, to the stylo-pharyngeus muscle. Let's start with afferent fiber. Alors, to draw afferent fiber, you have to put 3A, then 2V, then 2G. 3A, 2V, 2G. And then you add one S here and another S here. That go G is A, GVA, and SVA. G is A for general somatic afferent. It comes from the air to the trigeminal. GVA, general visceral afferent. It comes from the carotid sinus to the nucleus solitarius. SVA, special visceral afferent, come for the third posterior tongue to the nucleus solitarius. I repeat, afferent, 3 afferent, 2V, 2G, and you add an S here and another S here. GSI, trigeminal, GVA, solitarius, SVA, solitarius. GSA from the ear, GVA from the carotid sinus, and SVA from the third posterior tongue. In other words, from the air, pain, temperature, and touch, fiber go to the trigeminal spinal nucleus. From the palate, from the tongue, from the third posterior tongue, and from the eustachian tube, fiber go to from SVA to nucleus solitarius. They drive touch, pain, and temperature. From the carotid sinus, GVA go to the nucleus solitarius. Efferent fiber, two efferent fiber from the inferior salivatory nucleus, fiber coming to the parotid gland, and from the nucleus ambiguus, fiber coming to the stylo-pharyngeus muscle. Let's start with the trigeminal nucleus. Trigeminal spinal nucleus, GSA, general somatic afferent, coming from meningeal branch, external air tympanic branch for touch, pain, and temperature. Nucleus solitarius. In nucleus solitarius, there is two parts. There is a low part and upper part. Here we are talking about the lowermost part and a GVA, general visceral afferent. Touch, pain, and temperature. Posterior third of the tongue, soft palate, tonsillar, pharynx, eustachian tube, carotid body, baroreceptor, and chemoreceptor, and nucleus solitarius GVA, general visceral afferent, carry visceral sensation information from the carotid sinus and carotid body. GVA for carotid sinus and carotid body. Here the internal carotid artery, here the external carotid artery, here the common carotid artery, and the carotid sinus is between internal and external carotid artery, and carotid body is lower here. Visceral sensory general visceral afferent GVI carry visceral sensory information from the carotid sinus and carotid body. Here the nucleus solitarius, the upper part is for taste, SVA. The lower part is visceral area, GVA. And here in the side is baroreceptor and chemoreceptor, and this side is respiratory. SVA, nucleus solitarius upper part, SVA special visceral afferent, test from the third posterior of the tongue. Here the third posterior third, here the anterior two-third, the posterior third, there is glossopharyngeal nerve for pain and temperature, for test. Peripheral process start from the circumambulate papilla to join the inferior ganglion or petrous ganglion outside the cranial cavity. Here is the jugular foramen. Here is the foramen magnum. The central process goes through the jugular foramen toward the solitarius nucleus. Behind the sulcus terminalis at the posterior third of the tongue, fiber carry SVA test. Now we move to efferent fiber. Two types of efferent fiber. The fiber coming from the nucleus ambiguus to the stylopharyngeal muscle, and the fiber coming from the inferior salivatory nucleus to the parotid gland. Two efferent, both are visceral, special visceral efferent and general visceral efferent. General visceral efferent for nucleus ambiguus and special visceral efferent for nucleus salivarius. Now the structure of tympanic plexus. Here's a remainder of the middle ear. Inside the roof and the floor, posterior and anterior. Here the additus, the pyramid, the eustachian tube, the round window, and the oval window. The most important structure here, it's under the canal of tensor tympani muscle is the promontory. This is the landmark of the tympanic plexus. From the inferior salivatory nucleus, fibers are coming as GVA, as general visceral efferent to the parotid gland. Motor fibers are parasympathetic outflow that go to the middle ear as tympanic branch from lesser petrosal nerve and otic ganglion to the parotid gland. The tympanic branch of the glossopharyngeal nerve arises from the petrous ganglion and descends to the tympanic cavity through a small canal, the inferior tympanic cadiculus, and the undersurface of the petrous portion of the temporal bone at the jugular fossa. At the level of the promontory in the middle ear, fiber coming as tympanic nerve meet with fiber coming from carotid sinus to give the to give parasympathetic fiber to the parotid gland from lesser petrosal nerve via otic ganglion. From the internal carotid artery, the fiber come in as deep petrosal nerve. They meet the greater petrosal nerve at the level of the pterygoid canal to give the Vidian nerve. Stylopharyngeus muscle. Two efferents coming from the inferior salivatory nucleus to give GVE to the parotid gland, and the efferent fiber coming from the nucleus ambiguus to the stylopharyngeus muscle. Bronchiomotor fiber or motor fiber of the glossopharyngeal nerve originate from nucleus ambiguus before going to the jugular foramen. From there, fiber go to the superior ganglion before they supply the stylopharyngeus muscle. Here are pharyngeal muscle. Here is the stylopharyngeus muscle. All these muscles are innervated by vagus nerve except the stylopharyngeus muscle, which is innervated by the glossopharyngeal nerve 9 nerve. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.